Hello guys, welcome back to my YouTube channel. This is Rebecca Nkoba. Kindly hit that subscribe button. Say what? Hit the subscribe button and press the notification bell for you to get more videos that I'll be posting. Today we are going to be talking about the return date that the mother was given after 2 weeks. These clinics are very important. A mother after delivery given a take-home message, that is the health education, what she should practice while at home, then comes back to you to the clinic after 2 weeks with the baby. Generally during this period is only to determine what the mother, how the mother is faring on, and if she practiced what she was taught, and in case there is any problem, reporting. So once she comes to the clinic, you may see the mother from the gate entering the facility, or even at your doorstep in the hospital. First things first, we start with the mother, then the baby comes later, because now they are two in one. The baby that no longer depends on the mother in utero. Now it depends on the mother, whatever she feeds on, for it to get through the breast milk. So once the mother enters, you have to look at general presentation, how the mother looks like. Is there any weight gain? Is she neat? Any smell from her? Hair well kempt or not? How is her presentation? This brings you to a judgment on how she's faring on before you even get into various investigations. Afterwards, you greet the mother, give her a seat, and ask, what or how shall I help you? She gives you papers. Probably she never delivered from your facility. She's a first-time mother in your clinic. She was told to go to the nearest facility. Yours falls to be in the nearest. So you ask how she may be helped, and she tells you she has come for a checkup after 2 weeks. So after giving her a seat, you check the vital signs. Vital signs are things like temperature, usually determined by the gun thermometer. You can see the reading, 36.9. Normal temperature of a human being, a grown-up, should be 36.5 to 37.5. Below, it's hypothermia, low temperatures. Above 37.5, hypothermia, spiking temperatures. From that, if it is within the normal range, you continue to the second one, which is taking the blood pressure. They are usually measured by a machine known as the blood pressure machine. For those who've never seen such a machine, whereby we have the systolic pressure and the diastolic, then we have the pulse rate. The systolic pressure should be in a range of 120 to 140. Diastolic should be between 60 to 90. Below 120/60, that is when the pressures are low, we usually say a mother has low blood pressure. When the pressures are high, above 140/90, is usually high blood pressure. If it is taken and be noted to be within the range, that seems the pressures are normal. Then we check on the respiratory rate. Also the pulse rate, we've seen that it is recorded here. How the heart, the vessels beat. Normal should be between 68 to 72 beats per minute because it's how the heart tends to beat. Any deviation of the 3 vital signs, we've checked up on the temperature. If it is above, and we're in the era of corona, you should surely rule out an infection. We cannot say it's corona because corona has accompaniments of frontal headache, cough. Most temperatures, if they are taken to be high, there is usually a sign of an infection. So various tests are done. If the mother is not sure of where she is suffering from, various tests are done so that's true. They'll be able to come up with a diagnosis. We don't deal with differential diagnosis. If the blood pressure is above, we will monitor this mother before administering antihypertensive. If she has hypovolemia, low blood pressure, we will give a mother a health message of helping her take plenty of fluids, be it uji, be it water, milk, so that to be able to raise the blood volume. For the respiratory rate, if it is more than 24 breaths per minute, it shows that there might be some blockage in the cardiopulmonary system. So the mother will be treated with antibiotics. In case it's a heart condition, they will be treated according to the cause of the disease. Then the mother is given a cot and she's told to lie on it for further examination. We check on the breast in case there is any engorgement, that is any swelling, if the nipples are cracked, in case there is discharge other than milk that has pus or blood. And also these questions are asked to the mother in case if the baby breastfeeds well, or if during the breastfeeding there is some pain. This will enable the health provider give alternatives for this mother because the baby should be latched properly on the breast and they should be able to breastfeed well for 6 months. Some first-time mothers usually have problems with latching the baby, so they may be shown on the proper ways to latch the baby. In case it is engorged, they should get treatment of antibiotics and painkillers and advised on how best to feed this baby. A breast that is losing pus, it is advisable for the mother not to continue breastfeeding the baby on the same breast. They should express and pour. If the other breast is normal and okay, that is the only breast that the baby should be feeding from. The condition of the CS site on the abdomen, in case a surgery was done, is it healing? If not, she's recommended for daily dressing, antibiotics and painkillers. Or did the uterus go back to its normal position, that is involute? This is usually determined during palpation when the health provider will try to massage, that is the word palpation, to massage the uterus. They should feel it and it should be movable or ballotable. If it is balloting, it means it contracted and went back to its normal location and shape. If it is not, or cannot even be able to locate, it means there is a problem. Maybe some products of conception were left in, and it is advisable for maybe a CT scan to be done, or an obstetric ultrasound, most probably, to determine if anything was left. Also, there could be manual evacuation by the use of our hands, or the client may be advised to go to theatre to be examined. Then there is usually the general discharge that occurs after delivery. The discharge is usually in stages and colors. First is usually red, then goes to yellow before turning to pink, then the normal color. At this time, we expect it to be either at yellow or pink, depending on the health status of the mother. So it should be monitored and it should not have any smell, because if it has such, it shows it's a sign of an infection and the mother should be treated immediately. The pelvis, that is the vaginal area, it should be intact. In case there was an episiotomy that was done, it should either be healing or have healed or infected. If it is healing, she should be encouraged to sit on the saline pads. If it is healed, that is okay. If it is infected, the woman should be treated and advised on the warm saline bath 3 times a day. That is to take a shower and sit on the saline baths. Also during this time, the mother is advised to practice hygiene of high quality. After visiting the toilet, she should wipe herself from front to back, not to get bacteria from the anal orifice to the vagina. Vaginal examination is usually a must to notice if there is any tear, any lacerations, scratch, or if there is an episiotomy occurred that was not sutured. It is to enable proper healing of the mother. Once you are done with all that, it is recommended for the mother to go to the laboratory to check the blood volume levels, oxygen content in blood. Normally, it's supposed to be above 11.1 grams per deciliter. If it is above that, the mother is okay, she can continue breastfeeding. Because if it is below, it shows that the oxygen content in her blood is reduced. So there is no adequate supply of oxygen within the body. And if oxygen cannot reach the brain, the extremities, the lower extremities, it shows there is a problem and she needs treatment. The HIV status of the mother. This is an option because she may opt to come after 4 months, that is at 6 weeks. That is the recommended time when it is usually conducted, not necessarily at this stage. But if the mother tells you that there's a risk, that is if she thinks her husband is not faithful, it will be advisable for the healthcare provider to do a HIV test. Some mothers, during pregnancy, they could have known their status already, known HIV positive. Some, during the process of pregnancy, during the first trimester, the third trimester, during and after delivery, they could have been found positive. So in case their status were positive, it is good to continue with antiretroviral drugs, also known as HAT, and prophylaxis of cotrimoxazole, that is Septrin, and there is no need of conducting a retest for these mothers and their babies because they already know their status. Once the mother is okay, it is good to counsel them on family planning, both positive and negative status mothers. it is good to family plan so as to enable this mother plan for their next pregnancy and do spacing so that to be able to have a healthy family. So family planning usually begins normally at 6 weeks, but also we have another method of postpartum family planning methods. There are some that begin immediately after delivery within 2 weeks. It can begin at any time. So it is good to always encourage these mothers on family planning, and the message on family planning begins once the mother is pregnant. They should be aware so that they can start planning. If they have this pregnancy, they plan for the next pregnancy as early as possible through the health message. If they are aware, they know how to handle their situations. And family planning, it's for the benefit of the family. Having a healthy family, timely spacing, reduce contents of stress. So that is just a discussion that could have begun way back when the mother was pregnant. These are the times they're just told, when you're ready, you can now family plan. At any stage they feel it's a right to that mother, to the family, and to that child. Bye. Kindly subscribe to that. Hit the button.